Hello, I am Someswara Rao from Visakhapatnam, plus 71 I am now. Basically, I am a geologist. I had this breathing issue since 10 years and gradually the day to day, my situation is becoming worse. And Dr. Prem Kumar suggested me to meet Dr. Mohan, who is visiting Visakhapatnam every bi-monthly or monthly
I met Mr. Someswara Rao ji in one of my OPDs in Vizag. His main complaint was breathlessness. So whenever he walks a short distance, he had severe breathlessness and cough. This was troubling him so much that he is now not able to do his daily activities also. I have seen one of his CT scan that was done a few days before, which was showing a very large bulla. Bulla is a very medical term. In very layman language, bulla means it is actually lung which converts into a bag of air. So in the CT scan, his left lung was showing a very huge bulla, that air bag. Normal, we have two parts of the lung we call lobe in medical language. In the left lung, we have left upper part of the lung and left lower part of the lung. In him, actually, because of this large bulla occupying his left 2/3 of the chest cavity, his left upper lobe is completely collapsed. Because of the size of this huge bulla, it is compressing on his normal left lower lobe also. Next question is what to do. So in huge bulla, the dictum is whenever you find a huge bulla which is more than half of the chest, so the treatment is surgical intervention. Because he is elderly, he is 70 plus, the surgery, any lung surgery is going to be major kind of surgery. I thought any other alternative that we are left with this bulla. Unfortunately, the answer is no. So I had to go for surgical intervention in this patient. So in surgery, we have two options. One thing is you can go ahead with traditional open surgery, where you actually open the chest and separate the ribs, put your hands into the chest cavity and complete the surgery. That is one option. Second option is video assisted thoracoscopic surgery, what we call VATS. In VATS, we actually makes a small holes, about 2 to 3 centimeters of holes, and very small holes, and we actually put a camera into the chest so that we can see whatever the camera is showing. We can see the image on a screen, and we can put very small thin instruments inside the chest, and we will replicate the same surgery that we were doing earlier by open method. So since he's a elderly gentleman, so I thought VATS would be a better option in these patients, and I did VATS bullectomy. Means through this VATS procedure, I have removed the whole of this large bulla, which is about 15 into 15 centimeters of size. So fortunately, no part of the lung was removed in this patient. His left upper lobe, which was being compressed earlier by this huge bulla, has now expanded. The lower lobe, where there was pressure by this bulla, now it's relieved, and the pressure that is causing on the heart is also now relieved, because of which his breathlessness is better. Earlier, he could not able to barely walk or walking with a lot of difficulty. Now, with this surgical procedure, he could able to do cycling for 20 minutes without any interruption.
I'm so fortunate to meet, I could meet Dr. Aravind, who is the team leader of the entire lung specialization. And I'm profoundly grateful, first of all, Dr. Mohan, who built up confidence, and he has given his personal time. Every time whenever he is coming to me, the only thing, ask questions. I did not know, I don't know. The hospital, doctors I met in Visakhapatnam or some other place, they don't give time at all. Whereas he is entirely different person. He's almost like my son. Justly, I bow my head to him. And I'm really thankful to the Dr. Mohan, especially for him. Without any damage to the lungs, they made the operation. That is a great event for me. And without any pain of the things I got being operated. Thank you very much.